Hey everyone. All right, we got to talk about something that's been on my mind for years. If you've ever experienced bladder leaks, there's a really good chance that the very first piece of advice you received sounded something like, you need to strengthen, or maybe it was your pelvic floor, maybe it was your core, maybe someone told you to do more glute exercises, more bridges, squats, Kegels, and Pilates. And for some women, so many women, strengthening becomes the automatic prescription. And here's the thing, I do understand why. On the surface, it makes perfect sense. If you're leaking urine, we assume something must be weak. If something is weak, we must strengthen it. And that's how we've been taught to think about the body for a very long time now. The problem is the human body isn't nearly that simple. If it was, you wouldn't still be leaking, right? One of the things I love most about being a PT is that I get to be curious and get to ask questions instead of making assumptions. I get to really look at how someone's entire body is working together instead of focusing on one muscle or one symptom, one part of the body. I've learned that through treating thousands of women is that leaking is very rarely as straightforward as folks think it is. I think that is one reason so many women feel frustrated. Every single week I sit across from women who are incredibly motivated. These aren't women who have ignored their problem. They are not looking for a magic wand. They've worked really hard. They've watched the YouTube videos. They've downloaded the pelvic floor apps. They've gone to fitness classes. They've strengthened their core. They've done their Kegels while brushing their teeth even because someone told them that that's what they should be doing. Some of them have spent years trying to fix themselves. They bought the gadgets, and then I ask a question that usually changes the entire conversation. I say, so how's that been working out for you? And I can't tell you how many times the room gets quiet. Some women laugh because they don't know what else to do or say. Some get emotional because they're exhausted. Most of them tell me some version of the same story that kind of goes like, I've been doing everything I was told, but I'm still leaking. And that does break my heart every single time I hear it. Not because strengthening is bad. Strengthening is an incredibly valuable tool when it's the right tool. It breaks my heart because so many women start believing they failed and that they can't be helped. They assume they weren't disciplined enough or they didn't do it right. They didn't squeeze hard enough. They just assume their body is broken. And I want you to hear me when I say this. It is probably not broken. It's trying to communicate with you. One of the biggest mindset shifts I hope every woman takes away from work is this. A symptom is not a diagnosis. Leaking is a symptom, and so is pelvic pain. Pressure is a symptom, so is prolapse. Pain during intimacy is also a symptom, and the symptom tells us that something deserves attention. It doesn't automatically tell us why it's happening. If you have to think about it like this, think about your check engine light in your car. That light will tell you something needs your attention. It doesn't tell you whether it's the battery or the transmission, the engine, or a loose gas cap. Imagine if every mechanic responded exactly the same way to that check engine light when it came on. That would sound ridiculous, right? Like, that's essentially what many women though experience. Leak equals strengthening, no questions asked, no curiosity, no investigation. And as a clinician, that's always been hard for me to accept because I don't practice that way and I've never gotten results that way. When someone walks into my clinic, I'm not only interested in their bladder, I'm watching how they breathe, I'm looking at how they stand, how they walk, how they squat, how their ribs move, where their breath is coming from, how their hips move even, and whether old scar tissue is changing the way they transfer force throughout their body, whether their nervous system has been living in the constant state of stress, and even whether their pelvic floor is actually overworking or underworking. And all of those things matter because your pelvic floor doesn't exist in isolation. It's part of an incredibly intelligent system. And it's constantly adapting to whatever the rest of your body is doing. If your hips are not moving well, your pelvic floor is likely going to have to compensate. If your breathing is shallow all the day long, your pelvic floor will feel that too. If you have had abdominal surgery, or your body's going to adapt to that. If you've constantly been bracing your stomach or tightening and clenching that area, keeping your core engaged, if you will, your pelvic floor has to respond to that too. When you look at the entire body this way, you start to realize something really key. The question isn't, how can I get stronger? The better question is, what is my body really asking for? So sometimes the answer is absolutely strength, right? Sometimes it's mobility, other times it's coordination.